So I asked a third question. I said, is it just the elderly and immune compromised catching the virus and in need of ventilators? What are some of the common health traits that you noticed in those admitted to the hospital? And the source said, at the beginning, we never had to implement our surge plans or need extra nurses deployed for us for help. It was mostly nursing homes that were having outbreaks and deaths from COVID, which is facts.
Which is what we were saying before.
That's
too.
facts.
Yeah.
No, there's no cap there. Within the last month, with Toronto and other hospitals filling up with Toronto patients, I've seen a surge in patients, and it hasn't been just older patients. Since the surge, it's been mostly younger patients.
Wow.
Not some, mostly younger patients.
And now, I will go back to a point that I made in a previous video where, when this government is aware of a new variant, why were the borders still open?
No cap.
Like literally, because before COVID entered Canada, that's when it should have happened as well.
Do you remember the Ottawa airport? People traveling because it was around March break.
Yes.
At the beginning.
Yeah.
And the Cuba, we knew people. Remember, we knew people.
Oh, we knew people that we
thought left.
Yes.
Remember, they're like, "Yo, f this, I'm going."
Yeah.
Yeah, I mean that was the flavor. That was the mindset.
Literally, and they were conversating about closing airports, but never did.
Yeah.
And here we are. And now with this new variant, I guess we haven't learned our lesson yet. We also didn't close the airports once we heard about the new variant, and now it's in Canada once again. Round 2.
Facts. Yes, we have seen some that have had conditions like diabetes, and those people are sicker with COVID, etc. Weight gain, not weight gain, sorry, obesity, and any, if you're already entering the hospital with any other health issues with COVID layered on top, you're gonna have a much harder time.
Yeah,
basically. And they have been deemed higher risk, and they did get very sick. But I've also seen young, healthy people get very sick. So this virus, and especially these variants, are definitely not discriminating. That is a big eye-opener for me personally.
Huge.
Now, what do I know? What needs to be done? Well, of course, you can't depend on the government or the media to tell you to stay healthy, vitamin D, get your sun, exercise, get your sun vitamins like your sunshine, and try to maintain your health in light of all this stuff. Practice good hygiene, social distance, 1, 2, 3, right? But you try to do all that stuff, but you also think, well, there's also some really young, healthy people that are being admitted.
Yeah.
And actually getting really, really sick.
Yep. And
like passing away.
It's not a joke, man. And I hope this is a really a big eye opener for those people who think it is. Like we
never denied it.
I never denied COVID.
No.
You know what I mean? Like, I knew it existed.
Yeah, it's a real thing.
I'll admit at one point I never thought it was as severe as they're saying it is.
Yeah.
And I've known now a couple people who've gotten it. I know how severe it is, but at the same time, like, this is no joke.
No.
It's getting bad, man.